Steven Nadorczyk is a Team USA gymnast who won an Olympic bronze for the pommel horse. Now, he is, of course, bringing attention to this lesser-known sport as well as the eye conditions that he treats with his thick-rimmed Clark Kent-like glasses. Our KSTP health expert, Dr. Arkel Georgiou, is here to join us and really tell us more about it. We're glad that you're here. So kind of explain what this condition that he has for us.
Sure. Well, he actually has two eye conditions. One is rare. It's called coloboma, and that is when a portion of the eye is missing. It can be any portion of the eye. It could be the iris, it could be the optic nerve, it could be the retina, and it could have symptoms that range from nothing, depending on what portion of the eye is missing, versus all the way through to blindness if there's a portion of the optic nerve that's missing.
Wow.
The second condition he has is much more common. It's strabismus, and that's when the eyes are, as we always refer to it, as cross-eyed. That occurs in about 2 to 4% of the population, so really common, usually noticed in childhood. And you know, Paul, our eyes have 6 sets of muscles to let us look up, down, sideways, and torque a little bit. And so strabismus occurs when those muscles are not aligned. So the eyes can drift in, drift out. It could be one eye, it could be both eyes.
And that's how we would see him when he would take those glasses off. So how is that treated?
Well, the way that it's treated, it's in multiple stages. So the first thing that's usually done is that a patch is put over the lazy eye, the one that's drifting. I'm sorry, I'm going to correct that. The patch is put over the normal eye so that the lazy eye begins to learn how to use its muscles to see in alignment. It's sort of like physical therapy for the eye. It strengthens the muscles of the eye. If that doesn't work, then they go on to glasses or contact lenses that have a prism in them to, with the glass, force the muscles of the eye to turn the right way. And sometimes, in some cases, when it's not corrected, the child, sometimes the adult, has to have surgery to rebalance those muscles. What's most important, Paul, is to make sure that strabismus is noticed early and it's addressed early. And here's why. You know, early on, it's just a muscle issue. But what happens is the brain doesn't like it when you're seeing double, and when your eyes aren't aligned, you could have double vision. So as the brain is developing, when it's a small child, the brain can turn off vision in the eye that is not aligned, and you could have permanent vision loss. And so that's why it's so important to get this addressed early. It's not just a cosmetic issue.
And this is something that can appear in children. At what age?
Well, it can appear very early on, and it can appear and be noticed when they're 4 to 6 years old. It can also appear in adults. So, you know, there's something called pseudostrabismus. That's in very young infants who are born. We've probably all noticed seeing a baby that has, you know, we'll say, oh, their eyes are crossed a little bit. That's probably an optical illusion because of the shape of a baby's face, the width of the bridge of their nose. But anytime a parent notices anything that looks abnormal, they should talk to their pediatrician. But by the age of 4 to 6 months, the possibility that it's an optical illusion is probably over. And if you notice any drifting of the eyes at all, at any time, you should talk to your pediatrician and see an ophthalmologist. The other thing to look for is whether your child is maybe tilting their head. That's a way that they can maybe get rid of some of the double vision. Or sometimes they'll put a hand over one eye, again, trying to get rid of the double vision. Those are some clues that parents should be looking for.
Yeah, you got to really pay attention to that. That's
right. And it's not enough to just talk to your pediatrician. Really see a pediatric ophthalmologist who can do a full exam and make sure that their eyes are fully aligned.
They're going to know. Okay, Dr. Arkel Georgiou, thank you.